CEOs like him have a lot of blood on their hands. They're all worried about the bottom line, regardless of counting others their life because they denied them the treatment. Well, then, okay, let's say I agreed with you, which I don't, but I understand where you're coming from. You've lost loved ones because of United Healthcare and their claims. But you know why that happens? That's why I keep bringing up socialism. Socialism has merged everything. So United Healthcare has bankrupted other health insurances. This has already come out for years now, okay? And that's what happens. Just like all the hospitals merged, so everything is under one umbrella. So killing this guy did nothing. Because the true person at the top that's making all the decisions, there's only a handful of them. Because they've all merged because of socialists and their regulations. That's what everybody that thinks that there's some simple fix to healthcare is. No, all of the regulations that have been put in place have been put in by professional organizations that lobby. So the government at the federal and the state level is running your insurance companies, both. When you don't have all that regulation on them, then you don't have one CEO at the top that's telling every nurse and every doctor in the hospital what they can and can't do. You don't have all of the insurance companies being totally corrupt. Socialism is full of corruption because it serves the fucking bureaucrats. So let's say I did agree with you. And that, yeah, let's just kill CEOs now, which I don't agree with that. I think that attitude is stooping to their level. Because do you want to be like them? I mean, I get that you want revenge, but not at that cost. You don't want to become as snake-like as they are. Because eventually their time will come. Their time will come. Whether it's in this life or the next or both. And they will burn in hell. Okay? But it shouldn't come at the hands of others because you don't want to lower yourself to how disgusting the C-suite is. They're animals. They're animals that are just money hungry. And then when you get so upset that you think it's justified to go killing them, you know what they get to do? They get to say, we're victims now. That's why you should never do that. Go that route. Because then they can say, we need more protection. We have the everyday Americans are coming after us, which in this case, no, it was a globalist hit job. They took out a low-level guy because the very top of the system, the ones that are really screwing you over, are the globalists that have all merged and they all hide. You'll never see them at any meeting. They're the ones that take all your money and tell everybody, I don't care, cut them off. But they're doing the bidding of the government. So that's socialism. It's not the free market system. So all of this is a result of socialism. It's a result of globalism, the very thing Trump came into office this first time and was warning the American people about. And if you look into healthcare, because everybody thinks they understand it, no, you don't. You don't understand it. You don't understand that lobbyists for decades now through American Nurses Association, National Nurses United, American Medical Association, on and on and on. All of those professional organizations, which you can call bureaucrats, have been pushing their effing lobbyists to Washington to put one regulation in after another, and say it's for safety and it's for this. And all of that has merged everybody into one system, which is why they all have aligned with the UN and their Agenda 2030, factual information. And so that's what the plan was. So I'm sorry, because I know many people have lost loved ones because of United Healthcare and other insurance agencies, but it is a result of the bureaucracy of all your professional organizations of nursing and healthcare and others who have been lobbying, because when they control your health, they control you. So you don't want every regulation under the sun controlling insurance companies, private insurance companies. And Obamacare opened the door for this bureaucracy corruption. No man, I don't even want to hear what anybody who wants to be ignorant in this area carry on about affordable health care. The health care started really declining bad with staffing and everything when that was passed. And how did they pass that? They passed it in the middle of the night, as Nancy Pelosi said, and they didn't even read what was in it. They just wanted to push it through. You know why? Because they were serving the Democrat Socialist Society. And what socialists want is regulatory agencies everywhere to where you can't even see straight. That's why I read that article about what Dr. Ghali said that was on NIH that was written in 2018. All of this is a result of socialism and communists. So you'll never get to the true people at the top that are responsible for denying care to your loved ones. You never see them. You don't, just like I work in hospital. We never see the CEOs. We haven't seen them for decades. They've been hiding because they know what garbage they are. They know what they serve. They know they serve the federal and the state. They're the bureaucracies that is why corruption always seeps into the socialist system. And then the government makes out, and the bureaucrats make out, all those professional organizations, all the C-suite executives, and everybody that gets hurt is the average and the poor. So the answer to go and shoot these people down will give exactly the other ones what they want. Well, we have to protect ourselves. We're victims now. I wouldn't allow them that, because then you're the one that's been victimized. And they will turn that around because they're that ugly. They're that sociopathic. And that I will imagine that there will be some letter that most hospitals are going to put out to their staff about how there has to be more security around C-suite because they're so important, okay? And they're not. They're just ugly people, okay? Anybody that stays in those positions, ugly. Ugly because they sell out. They sell out for money. And the ones that stay there, really the only respect you can have for any of them is when they can just be honest and say, yeah, I sold out for money. I know I'm not doing the right thing. I probably shouldn't even have a nursing license or a medical license because I sell out, and then I try to lie to all my staff and patients that we care about you. Yeah, but they're never going to say that. So many people do not stay in those C-suite roles because they know they're giving up a portion of their soul to do it. Or they have a conscience, let's say. But this won't solve anything, except now they can say they're victims, that they need more protection, and they never take any responsibility. I mean, hell, you think they give a shit? They're willing to deny claims like this, but really it's because socialists are the government at the state and federal level are now controlling the private insurance. And because they are, and they're doing it through regulation, the only people that make out in that is all your professional organizations of nursing and healthcare, because those are the unelected bureaucrats and the politicians. They're ultimately pulling the strings of the CEOs. And the CEOs that go along with it, yeah, they're ugly bastards. But I would never, ever give them the luxury of being able to claim that they're a victim. And when people go shooting them down, well, that's what's going to happen.